Welcome to A Better Way, a sustainable approach to dentistry. I am Dr. Reed Winnick, founder of Dentistry for Health New York.
Hi, I'm Tammy Kolschmidt, dental hygienist, clinical thermographer, and body talk practitioner. And we have here tonight with us Dr. Niloo Dardashti. She is a board-certified psychologist and a coach.
Right, but she's also a life coach. So when patients come to see her, they're not just having a dialogue that's maybe going in one direction. She's very goal-oriented, very career-oriented, and she helps patients really get to the next level that they want to achieve. So with that said, welcome to our show.
Thank you.
And, I want to actually next talk about achievement and some action steps that our listeners can take, but can you just give us a brief background of who you are, where you came from, and why we think you're so great?
Well, thank you. So I went to LIU for my doctorate in psychology, clinical psychology. And after that, I got training in various holistic health modalities, specifically pertaining to mental health. So I got board certified by the American Association of Drugless Practitioners as a holistic health practitioner. So I incorporate that into treatment with patients.
That's great. And you know, for me, it's really important because my history, about 15 years ago, I was near death and I was on disability and out of work. And I was taking a lot of medication, and the first thing I did when I got well was to get off medication and find that by taking care of my nutrition and thinking about the things I put into my body, not only did I get healthier, but I got a better clarity of my thinking. And I definitely applaud you for being able to, you know, distinguish yourself by saying that to your clients, you don't need the drugs to get well. And yes, there is a place for medication and rescue medicine, and I believe in that. But once they get stable, let's now see what we can do to push you in the right direction.
I think the key point that you brought up was clarity, because until a person has clarity, they're going to stay stuck and they're not going to move forward, which is one of the things that Dr. Niloo is so good at is life goals, focus. And she can get you to that place of clarity so that you can then work on achieving whatever it is you need to achieve to feel good about yourself.
It's interesting because Tammy mentions clarity. It's like we know people could be toxic from mercury, from heavy metals. That can affect the mind. We know people can be toxic from too much mold exposure. And that can also affect their clarity. And unless you look at a person and say, well, where have you been in your past? Maybe these exposures are affecting your ability to really think clearly or to move forward, then just medicating them is not really the issue. It's just band-aiding it.
Oh, absolutely.
Right?
Yes.
That's great.
I want to hear a little bit about the clarity and what you do to focus them. Like, what are some coaching methods you use? In other words, if I came to you and I said, Dr. Niloo, I really want to achieve these goals, how do we do this?
So I think the universal thing that's important anytime you want to achieve goals, first is awareness. Awareness of who you are, what inspires you, what makes you feel passionate, what makes you feel alive. What are those things, and what is stopping you from engaging in those things or cultivating more of those things in your life? So if you were to you know, if we were talking about achieving your goals in terms of what you want to do with your life, that would certainly be one of the first things that I ask you to identify. I'd want to understand what moves you. What have you done to achieve your goals? What has worked for you? What has not worked for you? And what have been barriers for you to achieving your goals? So we can try to eliminate those barriers.
How would you eliminate the barrier of a family member or a spouse saying, you can't do that?
Well, most of the time when there's somebody saying you can't do that, we tend to internalize that voice. So you can have somebody out there saying you can't do that. It's what you do with that voice. Do you internalize that voice? And how loud is that voice? Because if there's a voice in your head that's quietly saying that and you can modulate it, no, you know what? I'm going to create my own reality, and I am going to do that.
You know, it's funny you say that because I remember when I came home from meeting the doctor that actually got me well, I spoke to my other doctor and I told him what happened, and he said, well, you can't do that. It doesn't, you're sick and you'll always be sick, we just cut you. And I just said, okay, and I hung up and I went on my way and went to the doctor, and here I am today. So I understand you can't really control people from doing what they say. They're going to say it, it's what you believe in yourself. But I think a lot of that comes from your own inner strength or self-esteem, saying, you know what, before I can love others, I have to love myself. Before I want to really take the next step, it's what I want, which is what's really important. And I understand what you're saying, because I know when I built the practice and I learned how to treat TMJ patients, there always were people saying, well, you shouldn't do this. You know, and I'm like, well, why not? You know, and then I just went ahead and it happened.
Good for you.
You know?
Yeah.
So I understand by lowering that volume is really,
yes,
really important.
very important to lower the volume of those naysayers, and especially if you've internalized that and started to believe it in some way.
Now, another question.
Yeah.
So what would be the best way to talk to our children when they're younger? Because children want everything, right? And they want to do everything, and we're like, you know, we're adults. And we're like, well, wait a minute. You know, there's got to be some boundaries. So how would you not want to squash your child's belief and feelings of getting everything and being able to be free enough to want everything, but keep it within a normal realm of reality?
I think that you've got to give your child room to just free flow. So oftentimes children are more expressive of their fantasy world and their imaginations.
Right.
So it's not likely that they're going out to try to do these things as children, right? They're just sort of putting them into words. Let them articulate it. That's okay.
Right.
Let them have those thoughts and let them talk about them and explore them and express them, and you can even explore them with them. You know, I would say try not to be threatened by those things, because you know, later on you can get into, well, what do you think is realistic? You know, how much do you want this versus this? What do you think is more realistic for you? What are you good at? What are your skills? You know, that sort of thing, helping them to explore that sort of thing. But as children, I think it's a good thing to be able to explore their fantasy world and such.
So it sounds to me, because I'm listening to the two of you talk, and what I'm getting out of it is you have to become very real with yourself to reach your goals. And I think that's why people are coming to you. Is that the bottom line? In order to reach your goals, you have to get real with yourself. What are your barriers, as you call them? What are your boundaries? And before you can see anything clearly, you have to kind of dig and excavate. Is that where you'd say to start?
Know thyself is a good way to put it.
Perfect.
Yeah.
Know thyself.
Working on knowing yourself, knowing your own limitations, what you really, having a visual of what you want to create for yourself is important. I help people to do that. So using some fantasy and then reality. So in fantasy, what do you see?
Right.
Okay, so how can we create that into a reality that's realistic?
And manifest.
Yeah,
Bring the
manifest.
manifest.
That's right. So it's a combination of different things.
Right. But a lot of people, when they want to achieve a higher goal, but they're internally they're afraid.
Yeah.
They're just afraid to let loose, whether it's a new job or whatever it is. So what would be your number one or two advice to how they would get started?
So one of the things that I was going to mention before, and it's applicable to what you're saying, is really identifying some of their limiting thoughts. Because we all have thoughts that limit us, that don't work for us. Right. And identifying what are those thoughts that are holding me back? How can I challenge those thoughts? And really inquiring into what, you know, the sort of beliefs that those thoughts arise out of.
Right.
So there's a lot to be challenged, really, in terms of the way that we allow our thoughts and our beliefs and our expectations and even our perceptions of the world and the people around us affect us and our behaviors. So that's a large part of it, identifying and then challenging. And on the other side, on the dialectic of that is also acceptance. What things about ourselves are we not accepting that we need to accept? You know, or what things are we disowning?
Right.
So it's not always just about
change, change, change. I need to do this better. I need to improve this. I also need to accept parts of myself.
Yeah, and that's getting real.
And that's a big problem for a lot of perfectionists here in New York.
Yes, it is.
I'll tell you that right now.
Yeah.
How long would you say this process takes to get to this?
I think it depends on the person, obviously, and it depends on the level of resistance that the person has to change or to acceptance.
Right.
Yeah.
So our goals here at the dental office is really to help our patients achieve optimal health through a healthy mouth. Right. So if we're looking for ways to help motivate our patients to do what we say, but not just do what we say, but really see the benefit of what we say.
And take their health into their own hands.
Right.
Yeah.
So what guidance can you give us in terms of how we can express it to our patients?
I think people need to take it into their own hands. So if you're having resistance with that, if you're having trouble with that, is to ask people, what are they thinking insofar as their health goes? Do they want their health to be better? Maybe you don't want your health to be better. Okay.
Right.
Okay, exactly.
That's your choice.
Right.
If you want your choice to be better, what do you think the steps are? I mean, I can tell you, what the steps are.
Right.
What do you think? What are you willing to take in? And what are the barriers for you in terms of actually doing these things that you do want to do or think you want to do?
And then they own it. And you're there just to support it.
That's right.
Yep. And when they're ready to shift, you'll be there.
That's
Right.
exactly right.
Right. So there are no special words we could use or any tricks?
Magic words.
I think it's I think it's in the questions. It's
the
in
open-ended questions.
Yeah, it's exactly what she said.
Right.
It is in the questions because you've got to allow people to own it.
Responsibility.
Yes.
Can you ask that question? I guess you could say, "Do you want to be responsible for your health, or do you want me to? Or do you want me to be responsible for it?" And if they see what they say,
Yes.
and that could be the motivating, driving force. Wait a minute, you said to me, it's almost like you're making an agreement, and you said, "This is what I bring to the table. This is what you said you bring to the table. Where are we?" And it's not that we'll get mad at them or be angry. Say, "Wait a minute, now we need to just recalibrate, recheck, and go forward again."
And it's likely that if these people have resistance to create the time or do what it takes to take care of their health, or that is repeating itself in other areas of their lives. And so maybe offering them some help insofar as what can you do to start creating more of your own reality, to do the things that you want to do rather than just talking about them. What's a good sort of realistic plan? And maybe they can have somebody to help them do that.
Right.
Certainly to help set that up for them
Yeah.
in a realistic way. Again, because a lot of the time what people do is they set these goals for themselves that are just too grandiose. Starting today, I'm going to spend an hour at the gym every day, and I'm going to eat this for breakfast, lunch, and dinner, and that's just a setup. That's a setup. We've got to think about moderation, and we've got to set goals that are realistic so that we're not setting ourselves up, because each time you set a goal for yourself and you don't do it, you kind of fall into more of a slump. That tends to happen.
Right.
The more you can meet those short-term realistic goals, the more it reinforces you behaviorally to continue doing that, because that feeling of self-efficacy, there's nothing like it.
Right. So when your clients are seeing you, they're not just getting the information about what they should know about what's, let's just say, call it right and wrong. You're actually, I don't say you're holding their hands, but you're actually pulling them in a direction that they want to go to because they've expressed it, and you're like their coach. Whether it's a football coach or a basketball coach, you're their life coach, and you're saying, "Hey, this is how you can do it," and you're available to give them that information, and also deal
and help them to come up with it too.
Right.
That's to come up with what's right for them.
Right.
I have I'm listening again, and another thought is coming to me. So I review everyone's medical history. Every time they come in, I see what's going on, what's changing, and I can tell you that a big one that's coming up a lot lately is sleep. Either it's not enough, they're not getting to bed on the right time, or it's waking up in the middle of the night. There's all of these things going on with sleep. So I just would I know that you work a lot in sleep. I'd love to hear a few of your suggestions that we can reiterate to our patients.
So sleep is a huge thing, especially here in New York. I think 9 out of 10 people will tell you they have trouble either getting to sleep, staying asleep, or both.
Yeah.
Talk about
yeah.
I'm curious about the getting to sleep.
Yeah, I mean, people
Even for
can't turn off
children.
their minds.
That's what it, yes.
And with children, great example, because one of the things I think is a huge thing here is all the lights and the stimulation. Aside from melatonin, which so many people know about at this point, and you know.
Well, tell us about it.
Okay, so melatonin being the hormone that's secreted from the pineal gland that tells us it's time to go to sleep.
Right.
You know, that
Wind it
circadian
down.
rhythm. Yeah.
Right.
When the lights are full blast at 10 p.m., 11 p.m., not to mention all the screens around us, all the stimuli that
Yeah.
are going all at the same time, the TV blasting in your face, the iPad and the iPhone and the this and the that. I mean, first of all, your melatonin, you got a problem there,
Yeah.
right?
It's too low.
Yeah.
It's not being produced.
Yeah.
Because of all the stimulation.
Yeah,
Okay.
your brain doesn't realize that it's
Right.
it's time to,
Zone out.
yeah.
Yeah.
Then there's something called glutamate, an excitatory neurotransmitter in our
Glutamate.
brains, glutamate,
Oh, glutamate.
that, yes, that is generally stimulated by light, flashing. And some people have excess glutamate to begin with.
Oh.
Can you test for this?
You can. There are ways to do it, but the data is limited on whether it really is conclusively valid. I will say that people who do have excess glutamate do great with the suggestions I'm about to give. In addition to a supplement called L-theanine, which does tend to lower glutamate, as far as we know. But one of the things I tell people to do is to dim the lights of all of their screens, starting around 7 p.m. Completely dim your computer light. If you can, get off the computer at least an hour before you go to bed, at best 2 to 3 hours before you go to bed. If you're reading, even if you're reading off of a Kindle or one of these Nooks or one of these things, you know, like you don't want to read from a book, fine.
Right.
Dim that light. You know, when you use one of those book lights, unfortunately, most of them are LED lights, which are very, very bright.
Yeah.
One website that I really like that I refer people to is lowbluelights.com, because it's the blue light spectrum that really affects the melatonin production.
So you want blue light?
You don't.
You don't want blue light? Okay.
It inhibits melatonin.
Right. How about red light?
So basically the light bulbs they sell and the book lights they sell and so on and so forth are made of amber colored lights. And they have these glasses you can buy and, you know, funky stuff like that. But generally I tell people not to dim all of their lights, to have room darkening shades in their bedrooms. You can get them for real cheap at Home Depot. Totally pitch black in the bedroom. Cover all the LED lights on the clocks.
Right. Oh yeah, that's a big one.
You know, and don't do anything stimulating at night.
Yeah.
People do work right before they go to sleep.
Right up until 11 o'clock.
Stimulates your brain.
Yeah.
I mean, it does. It's hard to turn that off when you're stimulated. Do something that relaxes you. What generally makes you tired?
Yeah.
I tell people to do breathing and body scans in bed.
Body what?
Body scan, which generally means to focus on each part of your bodies, starting with the tips of your toes, and just focus on relaxing each part. Really redundant and really just specific. Each part of your body, all the while doing some deep diaphragmatic breathing. The 4-7-8 breath is very nice and relaxing. 4-7-8, 4 is the inhalation count for count of 4. Hold for a count of 7, exhale for a count of 8. Very nice. I'm sure you've heard of that.
I already feel relaxed. I'm just thinking about it.
15 minutes left.
So yeah, I mean, these are just some of the things that I tell. I have a blog on my website that really in depth goes into a bunch
Just
of
mention your
different
website right now in case someone has to go to sleep.
www.cbttherapistnyc.com, and there is a particular very specific blog on sleep where I give a lot of good suggestions.
Right, and if you didn't get that, then just contact myself or Tammy at 212-973-9425, and we have all of Niloo's information. Okay, so now that we know how to get to sleep, why is sleep deprivation such a problem? Why is it so important to have good sleep?
So the less sleep you have, the more it affects your mood, your patience, your threshold to handle things, to concentrate, your threshold for stress, and it's a vicious cycle. It's a chicken and egg thing, right? Cortisol being high at night is one thing that really disrupts sleep. Talking about staying asleep, I just want to say is breathing issues during sleep, as I'm sure that you guys deal with all the time.
Yeah.
You know, and I tell people if they're not sure to get checked for whether they snore, for whether they have some obstruction.
Yeah.
You know, these appliances, I'm sure that you make here are so useful to so many people.
Right. It's
clenching. You know.
Right. We're discussing obstructive sleep apnea, and what we know is that everyone who has sleep apnea snores. Not everyone who snores has sleep apnea. These are your patients who are at a higher risk for number one, heart disease. They're also at higher risk for daytime accidents, car accidents, because they fall asleep at the wheel. Or you have patients who are walking around who are they're fatigued.
Yeah.
And they're going through all these doctors and they can't figure out why they're tired, but they have an undiagnosed sleeping problem. So it's really important to have a sleep study if you find that you're fatigued, or even if you have high blood pressure, if you have any risk of heart disease. So sleeping is a big issue for us. And as dentists, we can treat most of the problems using what's called a Cpap machine, which is you look like a fighter pilot with a mask on, and they want you to sleep with that, which is hard enough. But it's very effective. It forces air down your throat. But if you're not comfortable wearing that device, like most people aren't, a dentist can make a special device that opens up the airway so you can sleep. And then your whole life changes.
So important.
And your spouse's life changes because you're not snoring anymore. You know, so it's a big plus for everybody.
Helps your relationship.
The relationship. It's all about relationships.
It is all about relationships.
That's right.
And Dr. Niloo has done a documentary on the saga of Twilight, the books and the movies. Start telling us about it.
You know, before I start telling you about it, I had one thought that I really wanted to share with the viewers about sleep and helping relationships.
Oh, do tell.
One thing that I think has been tremendously useful to a lot of people is buying 2 twin beds, putting a king-size sheet over it, and actually making that into their bed. The reason is that a lot of people are light sleepers.
Did that. Go on.
Okay. A lot of people are very light sleepers. Their spouse moves, they wake up.
Right.
Speaking of which, people sleep with their pets. Their pets move, they wake up. Don't sleep with your pets. All right. And if you're waking up because your spouse is moving consistently and waking you up, you know, get 2 twin beds. The Europeans do it. All over Europe they do this. I think it's amazing.
Okay.
They put a king-size bed over it and you sleep on 2 twins. You don't feel the other person move. It's fabulous.
Oh, that's so interesting.
Yeah.
I don't think my parents did it for that reason, but...
Well, they probably separated the beds.
I think they had 2 extra twin-sized beds and they put them together.
But you gotta put them together. You gotta have that togetherness.
No,
Definitely.
they were always together, but they had the one big sheet.
Yeah.
All the time.
Oh, they're smart.
Yeah, I would sleep in the middle between them, and I'd fall between the 2 beds. But that's a different. We can discuss that later on.
Okay.
Well, let's recap the sleep just a little bit, because you've made some really good points, and I would just like to recap. So you said turning down the screens, right? The computer screens, the TV screens, a few hours before bed.
That's key.
And then you said trying to not work on the computer right up until bedtime. So give yourself some wind down
And that
time.
means the iPad too.
Right.
And with that.
And the iPhone.
And all of that.
And the BlackBerry.
All those
But
gadgets.
even, I guess, the Kindle, the book.
The Kindle.
Because
I mean,
it
all
has
of
that
these-
radiation and the light
Yeah.
coming off. It's not the same softness you get from a book.
No.
Right.
No, it's not.
And then you had mentioned amber-colored lights.
Yes.
Now, you said something about glasses. When should one wear the glasses?
If one finds that even watching TV is sensitive for them, I mean, you can experiment with this. You can try not having any lights and see, you know, for 3 hours before bed, not watching any TV even, and see if that helps your sleep. over a
Okay.
couple of nights. If
Right.
it does, it's safe to say that was really affecting your sleep. Then maybe, you get one of these glasses so you could still, wind down and watch some TV at night if that's what you like to
Right.
do to relax.
Right. But
And I was going to say, then another thing was the breathing, right? That's part of the list.
Also, not eating.
I was just going to say,
close to
what
bedtime.
about
how
food?
close
Yeah.
to bedtime?
Ideally 3 hours, but there are some people that actually need a little bit of something before they go to bed.
And that actually calms them.
Yeah.
Like
Which
milk and cookies. We all grew up on that,
We-
right?
Right.
But she mentions the amber lights. Many patients of ours tell us they wake up in the middle of the night to go to the bathroom, and then they open the light up, and that messes up all their hormones. So
Yeah.
they
They're
actually sell
sensitive, yeah.
these. They sell a flashlight that has a red top on it, so you can still see, and the red light doesn't affect your hormones when
Yeah,
they
that's
wake
right.
up. So they can use the flashlight to go to the bathroom.
Oh, that's
Right.
great.
and
That's
do that.
great.
Yeah.
Yeah.
And since we're talking about sleep anyways, I think we should bring up the sleep sanctuary idea, like you said, of keeping the room dark.
Yes.
Also, don't keep your cell phone by your bed. Just remove it from the room.
Some
yeah.
people though who live alone feel like they like to have their phones there as in case of an emergency. So I just tell them, just put it, turn it off and put it as far away from you as you can.
Yeah.
And also, speaking of sanctuary, is to make your bedroom really like a peaceful cocoon.
Yeah.
Where
A
that's
safe place.
Yeah, I mean, the temperature, the sheets, whatever feels good for your
What
skin.
about those eye shades? Are those important?
Perfect.
Yeah.
We are going to have Niloo again. And I really
Again.
want to dive into her project because it's exciting. It's exciting for women. It's about the Twilight series and her documentary, which is at twilightdocumentary.com.
So it's basically just a documentary about the allure, the fascination of Twilight across generations. So why are women so fascinated with Twilight, and how can it help your relationships and your love and sex life?
Oh, wait a minute.
Awesome.
That's something we need to tune into.
Oh, God, so now he perks up. Okay.
Well, I want to thank you for joining us tonight, and thank you again for joining us.
Thank you for having me.
You're very, very welcome. I am Dr. Reed Winnick from Dentistry for Health New York. Our phone number, if you have any questions about tonight's show or any other dental questions, is 212-973-9425.
Thank you. And you can email us at reid, R-E-I-D, at dfhny, or you can email me, Tammy, at dfhny.com.
Right, and our website is www.dentistryforhealthnewyork.com.
Thank you.